Here's our next video on ACL rehabilitation, following an athlete from surgery all the way back to the field. We are now in week 9 of Maddie's post-op progression. At the end of phase 2, we want to continue to maintain full motion, build a strength base, progress balance activities, and progress the functional activities similar to what was noted last week. In regards to progressing the strength base, we worked on improving her form with lunges. We used a little external support to help here, and it transitioned to better form when she was on the field. We also added some variations with a med ball twist with a lunge and an overhead reach with a lunge to get different forms of trunk stability. We also did some side planks with rotation and incorporated the Houston's exercises with an isometric extensor contraction on the Roman bench, so that we got both back extensors, glutes, and scapular stabilizers all working at the same time. Now in this phase of rehab, we really want to try to incorporate as many muscle groups as we can and bringing both upper body, core, and lower body muscles and tying them all together. And this is one of the ways that we're able to do that, as you see here. Now you do have to limit the amount of resistance that they use because it is a difficult exercise, and you don't want to over fatigue them and have them lose their form when they're in the extended position and put more stress on their back. Here's a dynamic example of the planks that we do with rotation. You can vary the size of the weight that they use, but you want to be able to make sure that they control the motion while they're going through. Here you see the walking lunges with the twist. We tend to twist the ball over the front leg. It just helps bring their center of gravity in a more controllable position and easier for them to balance. Here from the front now, we can see them doing the walking lunge with the overhead reach. Again, it displaces the center of gravity differently and has them reach a little bit overhead, work some of the scapular stabilizers, as well as some of the trunk stabilizing muscles in a different fashion than what was seen before. Now we have them going into a lateral lunge with the viper cord or resistance cord on them. And you have here, she's doing kind of a bounding exercise, just kind of stepping into it. And then she can work on the eccentric loading, which you can see which is a little harder for her to do on that left side. In regards to her functional activities, we added some balance activities, some cone reaching drills. We brought out the soccer ball that made her very happy, and you'll see how we incorporate that coming up. With the reaching drill, we had her stand on both her involved and her uninvolved side, reaching to each of the cones with either arm so that she's going across her body in different patterns, each time trying to do it in a slow, controlled movement, keeping both a knee position and the spine position as you see here. We added some slide board to work on some lateral mobility. We started a very short range of motion as we're trying to get her to get used to pushing off and loading that left side, which you can see she has some difficulty doing. She really just wants to push with the right and doesn't want to push off the left. We call these mountain climbers. There's different versions of it. It's a good cardio exercise, works on some hip flexors and some stabilizers. We started some heading drills with the soccer ball. Her heading skill is better than my throwing skill. We put her up on the Dynadisc to make this more of a dynamic exercise, which she enjoys. It also helps bring in some abs, some trunk, and some balance, which is a great combination exercise for her to do. And last but not least, we had some volleys. First, we had her standing on her left leg, her involved leg, and kicking some volleys with the right. I'm standing about 5 yards away, and then we had her switch. She's standing on her right and kicking with her left. And you'll see here coming up that she's able to do it. It certainly isn't as controlled or as forceful as it is when she's kicking with her right, but that's more a form of confidence. We met all of our goals for phase 2 and get ready to enter phase 3, which includes running and impact activities. If you have any questions about anything up to now, please put your questions on our post.